America's healthcare advocate, Kerry Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. Also, all the shows are up on 14 podcast platforms. Actually, it's 15 now. So we're out there. If you want to find us, you're not going to have any trouble finding us on a podcast platform. And our YouTube channel, America's Healthcare Advocate. We are also on 234 radio stations, coast to coast, our newest one being KRFE 95.9 AM and FM in Lubbock, Texas. We want to thank those folks for putting us on the air. Anthony Garza is the program director there. We are very happy to have them on board and welcome them to America's Healthcare Advocate family. My producer today, Mr. Darren Wilhite behind the microphones, and Mr. Dave Thiessen behind the camera, who does all of the podcast YouTube work. If you are chronologically challenged and you are looking for Medicare in any way, shape, or form, anywhere in the country, you can call Carol Lee Steele at RPS Benefits by Design, 877-385-2224. She can help you with anything. She's a certified Medicare expert with your aging in, special needs, whatever the case may be. Maybe you just want to talk to somebody. She can help you, 877-385-2224. If you're looking for employer-sponsored health care, I normally tell you to call Maria Allers, but today she's sitting right here. Welcome back, Maria.
Hi, Kerry. Nice to see you again.
Nice to be here. Joining her in studio with me is Cheryl Lawrence. She is the Senior Account Manager and Team Leader over at RPS Benefits by Design. And Maria Allers is the Chief Operating Officer at RPS Benefits by Design. And guess what we're going to talk about? We're going to talk about employer-sponsored health care and the role of the health insurance broker. You know, you might think, do we want to hear it? Yeah, you do want to hear it. You know why? Because you don't know what you don't know. And we're about to educate you on what brokers should be doing if they're not doing it, what you should be asking for, and more important than that, what you should be getting. So let's just dive right in.
Sure.
What the role of the broker, you know, I haven't done this actively for about the last 4 or 5 years since RPS and BBI became one company, but the role has changed, Maria, and it's changing almost constantly. But let's just talk about the overall role of the broker and how important is that role and how they interact with that employer, whether it's a 5-life group, a 50-life group, or a 500-life group, Maria?
Right. Kerry, we know that benefits is 25 to 40% of a company's payroll. And so with such a large cost, companies really need to be able to find competitive solutions. And so that's what insurance brokers do. We're the intermediary between an employer and the carrier. We provide you benefit strategies that gives your company a competitive edge for recruiting and retention. Everyone's out in the market looking for great talent, and that's what brokers do, is we help provide a holistic approach to your package so you are able to keep and retain employees. But not only that, brokers also help, they have a profound effect on the health and welfare of employees and their families. You know, if somebody has cancer or if mom needs a nursing home, those are the things that an insurance broker can advocate for the employees.
That's what they should be doing.
That's right.
That's not what they're always doing,
That's
but
right.
that's what they should be doing.
That's right. They should be doing. A broker knows the employer's needs, and then they know what the carriers require. So we're able to marry those two together to find the right plans for your employees.
So I guess it's safe to say that there's a lot more to it than walking in once a year and laying down a spreadsheet and say, pick your poison.
That's right.
You're laughing at that, but I'm telling you, there's a huge number of brokers out there, and that's exactly what they do. I remember, oftentimes going into a broker, doing a presentation, and then we'd close the deal and write the policy, and we'd be back in front of them 3 months later and back in front of him. You're the first one that ever did this. My broker never did this. They never came back in and talked to us to see how things are going. That being proactive like that, how important is that? So you know what's going on within the company?
That's very important. We have technology that helps us with that. So if you're hiring or letting go of your workforce, we are able to be proactive and look at your strategy. Are the plans working for you? Is it meeting your employees' needs? What carriers match what your needs are? And also meets your budgetary requirement. As we talked about, benefits is one of the largest piece overhead for an organization, but it's needed to keep the employees happy. So being proactive, getting in front of our clients, we work on renewals about 120 days out. We start the conversation of, are you happy with your plans? Is there anything we need to shop for? The world is constantly evolving with benefits. Things are changing, and it's our role to keep up to date on the plans, the compliances, the technology. And really, it's being a broker has become a complex profession because of the process. And really, everyone needs a broker regardless of the company size, because each company size needs different things. And they don't know, like you said, they don't know what they don't know.
Well, and they don't have time for this, Cheryl. That's how important is it for them to know, the employer to know that, hey, when you're, when you're one of your employees is standing at a prescription drug counter and they can't get a prescription filled, that they can pick up the phone and call you and get somebody that's going to say, yeah, we can fix that for you. Yeah. How important is that?
Very important, because that person obviously needs those drugs right now. They haven't gone into the pharmacy just to pick it up for whatever reason. But when that happens, and it does happen quite frequently, yeah, we can just pick up the phone and we can call the carrier and say, why is this prescription not being filled? And usually there's a reason, and we can usually get it rectified, and the person can go right back in or as they're standing there and get that prescription filled.
Yeah, it's funny, because I remember this would happen, more than you care to have it happen. And the first thing that the person standing at the counter does, first thing that the member does, is they think the insurance company's denying me. Probably about 7 times out of 10, it was the pharmacist had coded the medication wrong. So talk about that, because that's exactly what I'm talking about. That's the genesis of, you've got to be there, just like Maria said, you've got to be the advocate. That's a simple thing, but they don't know that. And the pharmacist is telling them, that's not covered. Yeah. It's just not covered. And of course, who are they going to believe? Yeah. Well, you got the guy in the white coat saying it's not covered. Mm-hmm.
And sometimes it's even talking to the pharmacist and say, hey, can you just pick up the phone and call the physician and see if you're reading that prescription correctly? Because sometimes they aren't reading. You're right. They're not reading it correctly. Or sometimes the physician has even written the prescriction incorrectly.
Yeah, well, that's another thing. If you try to decipher doctors' handwriting, sometimes forget about it. Okay, they're a lot better off if they're just typing it and sending it by email or whatever the case may be. Because if they hand wrote it out, good luck.
Yes.
In fact, I remember that's really funny, because I had one that I had to take, and I remember that the doctor gave me the prescription, and on the way out, the nurse took it back and said, let me rewrite this for you. Okay, because you couldn't read it.
That's right.
Okay, so but it sounds simple. But boy, when you're standing there at that counter and you need that antibiotic, or your child's got pink eye, or you've got a spouse that's got a major medical condition and they can't get that med, the level of frustration goes through the roof.
Yes, and you feel it through the phone that employee is very frustrated, and that's also part of the job, is just also to try to calm that employee down. It's like, just hang on, we'll get this fixed. And
because the first thing they're going to do is they're going to go into the boss's office and say, those people didn't do their job. Now, unfortunately, that is often the case if you've got a broker that is not paying attention to this stuff. I used to do a commercial that would say, you can either call us or you can call the 1-800 I don't give a damn number. And the 1-800 I don't give a damn number referred to the insurance carrier. Because in a lot of cases, some of these carriers, we're fortunate here with Blue Cross of Kansas City, you've got local customer service. But when you're talking about the big carriers like United, Aetna, Humana, et cetera, you're calling into a call center, and maybe they're going to be able to help you and maybe they aren't. And that's the difference. And that's why we're doing this show today, is to explain to you the difference in the way this should be done and the way that sometimes it does get done. If you want more information on RPS Benefits by Design, maybe you'd like to talk to them, you can call 877-385-2224, 877-385-2224, or go to their website, RPS Benefits by Design Inc., that's INC.com. We'll be right back after the break. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You know, if you listen to this show, maybe you're that employer, and you know it's a small company. It's you and your wife, or you and a partner, whatever the case may be, and you're listening to this, and you think, you know, we really should take a look at that. But I got to go explain this to my partner. No, you don't. Get them to go up on the podcast platform, on the YouTube platform for America's Healthcare Advocate. We're on SoundCloud. We're on every podcast platform out there, okay? And you can have them listen to the show, okay? And then they'll hear what you're hearing, and you don't have to go back and regurgitate the whole thing. It's just a great way to do it. The folks at RPS Benefits by Design can be contacted at 877-385-2224. That's 877-385-2224, or online at rpsbenefitsbydesigninc.com. In studio with me, Maria Allers. She is the Chief Operating Officer, and Cheryl Lawrence. She is the team leader at RPS Benefits by Design, and we're talking about the role of the broker and how that affects you if you're the employer. So you told me a story we meant to break off air, and I want you to tell. This is a classic illustration of what happens when we're dealing with an insurance carrier, and a member walks up to a prescription drug counter, a pharmacy, and needs to get a piece of equipment or a drug. Tell the story, Maria.
Yeah, Carrie.
And what time it happened during the day?
Right. Last Friday, it happened late afternoon, about 3 o'clock. I got a phone call from one of our client and of course, it's the CEO of the company. So lucky us that this happened to the CEO. And he had taken his son to the hospital to pick up the insulin machine that his son needed.
So his son is a type 1 diabetic. Yes. Okay, so this is really serious in kids. All right, so go ahead. So
last Friday was the end of February, and as with any company, you have a renewal date every year, and his effective renewal date was 3/1, which was the next day. And for some reason, when they went to go get the insulin machine, they got denied coverage, that it wasn't covered. So they called us at 3 o'clock. We pulled the team together. We called the pharmacy. We called the hospital. We called the doctor. But most importantly, we called the carrier. We escalated it because we have the relationship with the carrier to upper level management. And as a team, we got it taken care of by 5 o'clock on a Friday, Carrie, on a Friday.
Yeah, they weren't out playing golf, people. That's what I'm trying to say, okay? But that's exactly what I'm talking about. This is critical. This is not a prescription drug. If you've got a child that's a type 1 diabetic, I mean, that's a risk for mortality. There are all kinds of things that go into that. It's a very difficult situation for a parent. And I can only imagine this parent's frustration. He shows up at the last day of the week on a Friday at 3 o'clock. He's supposed to get this insulin machine so that his son can have the insulin he needs to survive, and he's told it's not covered. Mm-hmm. Okay, but you got the problem solved.
Yeah, we did, and that's the beauty of using a broker, whether it's local, regional, or nationwide, is because of the relationship you have. And you can call us directly instead of that, as you refer to.
I don't give a damn number.
Yes, that's right.
I'm going to tell you something, people. If you call one of these carriers, and I'm picking on the big boys, United, Aetna, Blue Cross here in Kansas City has got local customer service. It's a whole different deal, and they've won the J.D. Power Award 3 years in a row for best customer service in Kansas City, in the metro. Okay, so they do it a little differently. But you call the big guys and you try to get through. I'll tell you right now, you're going to get 4 or 5 voice prompts and maybe you'll connect with somebody that can solve your problem, and you're going to spend a significant amount of time trying to do it. Even with Blue Cross, the point I'm making is when you have a broker that is your advocate, that really is engaged and knows what's going on, it's exactly, Maria brought the team together and they got it done. And by 5 o'clock in the afternoon, he was on his way home with that insulin machine. It's just really important.
It really is. You want to think of a broker as an extension of your team, where if you need help, we're there as your partner to advocate for you, to go to bat for you, to really figure out what the root cause of the issue is. And really, you just call us and hand it over to us, and we take the issue and we come up with a solution.
And that's the way it should be. So Cheryl, different employers have different needs.
Right.
And so it's important for you to know the background of the employer.
Right.
So if you're dealing with a general contractor who's in the construction business versus a woman or a man who owns a company that does home health care
Right.
versus somebody that owns a restaurant,
Right.
you're talking about a very different kind of workforce. Talk a little bit about that.
Right.
Why is that important?
Well, because you want to be able to offer your employees, whether they're full-time or even part-time, you want to be able to offer them some sort of medical benefits, because I think we all feel that everyone should have medical health care, period, somehow. When I'm talking to a contractor, in fact, I'm working on one right now, he just wants some major medical. He doesn't want any bells and whistles. He doesn't want anything. He just wants some good medical coverage for actually, there's about 3 employees. Now, with home health care, there you have another problem, because a lot of those men and women don't work full time. They only work part time. So we have to find a carrier or an avenue to help those people find some health insurance that, again, will meet their needs, but they can fit in that box of they're not full-time active employees in the general sense of 30 hours per week.
And it's going to be really affordable, because those people don't make a lot of money.
Unfortunately, those people do not make a lot of money.
And the other part of that, I'm assuming, Cheryl, is that the employer that has a home health care business or construction business that has a benefit versus the employer that says, well, I'm going to give you $150 a month and you go out and find your own. How does that affect their recruiting and retention?
Well, I don't think the recruiting will be very good, because, to be honest, if you're just going to give me more money and say, Cheryl, go out and find your own health insurance, I don't know that I will do that.
Number one. Number two,
know.
Can you even find it for a price you can afford?
Where do I even start? And then that's why you need to call us. It's like, okay, even if you want an individual plan, if your employer is just giving you X amount of dollars, we can still help you with that. We have a gentleman in the office that can help you with that. But I just want people to call us, because we want to help them find health insurance. I don't want anybody to go out there without any health insurance.
You can tell from listening to Cheryl and listening to me, there's a passion for this stuff.
Yeah.
And if you don't have the passion for it, if you're just doing it because it's a job or whatever the case may be, it's a whole different world. And unfortunately, in the world of brokers and health insurance, there's a lot of that goes on, especially when you're talking about these extremely large agencies where that level of personal attention is not really there. It's all about the numbers and how many are you going to get done and how many are you going to sell and all the rest of it. It's a little different when it's an agency where there's a lot of personal attention, and that's what they do at RPS Benefits by Design. If you want information, you can go to the website, RPS Benefits by Design Inc. That's RPS Benefits by Design Inc. Or you can call the lovely Maria Allers at 877-385-2224. 877-385-2224. We come back from the break. We're going to tell you what you need to ask when you're interviewing a broker or talking to a broker. What should you be asking them to do? And what should they be telling you they can do? Stay tuned. We're right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Don't go anywhere. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. If you have a question, a comment, or something you'd like me to talk about, or maybe you've got something I can help you with, go to the website, send me an email. I am happy to help you. We get calls all the time. We get people that reach out to us. I'm more than happy to help in any way that I can. The website's americashealthcareadvocate.com. In studio with me, Maria Allers. She is the Chief Operating Officer at RPS Benefits by Design, and Cheryl Lawrence. She is team leader at RPS Benefits by Design. You can tell they're engaged, you can tell they're passionate, and you can tell they know what they're doing. If you just want to talk to somebody, maybe you're not really happy. Maybe you think your broker's not really all that in a bag of chips. Well, give them a call. Have them come in and just sit down with you and talk to you about what you're doing. Maybe everything's great and they're not going to recommend any changes. Maybe they will. You won't know until you call them. 877-385-2224. By the way, I don't care where you are in the country. They can help you anywhere. It doesn't matter. You could be in Arizona. You could be in New Mexico. You could be in Mississippi. You can be in Florida. They'll be more than happy to help you. Jump on a plane and be right in your office and sit down with you and do whatever they can to help you. The phone number, 877-385-2224, 877-385-2224, or the website, rpsbenefitsbydesigninc.com. My producer behind the microphone, Mr. Darren Wilhite. On the cameras, Dave Thiessen. So you're going to Phoenix. I speak jumping on a plane. You're on the way to Phoenix here in another week or so, aren't
That's
you?
right, yeah.
Yep.
To go meet with our clients out in the Phoenix market.
There you go.
We
She travels, okay?
I do. We just got a client, last year, right, Cheryl, in New Zealand?
Australia.
So we've gone, we have international clients now. So we can do really anywhere in the world,
Well, I'm
literally.
going to top the Australia one because I actually had a client in Guam.
Wow. See, everybody needs benefits, Carrie.
And that came off the radio, so it
Yeah.
was really coming. So let's talk about what should a company do when they're looking for a broker. If they made the big mistake, some of these carriers you can write direct policies with. I think that's a real mistake if you do that. But having said that, what should a company do, whether it's a small company or a large company, when they're looking for a broker? What should they be looking for?
Well,
what should they do?
I think first off, it's important for employers to know you can change brokers at any time.
Oh, wait a minute. You don't have to wait till renewal?
Nope, you do not have to wait for renewal. You can change at any time. If you're not happy with your current broker, what we say is don't suffer in silence. Give us a call, and we are happy to help you. But most of the time, our employers feel like they have to do it during renewal. So if that's where you're most comfortable, that's fine. What you want to do is shop way in advance because the process takes time for you to vet out your options. And then what you want to do is once you've made your list of companies that you'd like to vet out, you want to look and see what their experience is, what the team looks like. Things you want to really ask is, are they very compliant? Is compliance a big part of their list? Depending on what size company you have, compliance range from, very little to a lot, to red tape, and we can help you walk through that. Technology, as you know, is always happening, and technology helps to run your company better, and that's what we want to help do. When you're looking at a broker, you really want to make sure your broker, as I mentioned earlier, has a holistic approach. You're not just looking at coverage and rates. Any broker can do that. You want to look and see, do they provide you with the company strategy that is in alignment with what your goals are? Are they able to help meet your budget? What about the plan design? What about HR strategies? I mean, with my years of over 25 years experience in HR, that's a big piece to what HR executives look at is the benefits. What's the strategy? And then even IT. How does that impact your company, and how can we help utilize your IT to make your package more robust, easier to shop?
Yeah, this is interesting because one of the things I remember from experience is that people would wait. We're talking about the renewal time now, and they would call 30 days before the renewal. Like, I'm not happy and I need. Well, we don't have enough time to do this the right way in 30 days. And oftentimes we would tell them, look, renew. Okay, just take it and renew with whatever you're going to do. All right, let us see what the renewal rates are. Renew with that broker. okay, and then let us have time to come in and put a package together that makes sense for you. But waiting until the last minute is not. You don't, if your renewal date, let's just say you've got an off-year renewal. You renew in like June or July because maybe you're on a fiscal year, not on a calendar year, blah, 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 blah. And you wait until May to pick up the phone and say, hey, I'm not happy. I want to see alternatives. That puts you in a real jam because you're trying to do something that normally takes 60 to 120 days.
That's right. It does. And we are trying to gather a lot of information. And we're also working with carriers. And we're out there with our RFPs to try to vet out the most, not only affordable, but most comprehensive plan for your team.
And we all know that insurance carriers don't move with the speed of light.
No, they don't.
Okay. Some are better than others, but I have news for you. They don't move with the speed of light. And trying to get things turned around with them sometimes is like trying to turn an aircraft carrier around. It just becomes extremely difficult. So the more time you have, the better job you can do when you go in to evaluate, as Cheryl just talked about in that last segment where, well, if it's a construction company, they don't need the same kind of health care that somebody that runs a restaurant needs or somebody that runs an IT firm needs or somebody that runs a home health care company needs. So those are all things you need to understand. I remember sitting down with a nursing home group that had 5 nursing homes. In fact, I took Ron Rowe to the presentation from Blue Cross and Blue Shield, and I asked the question, what's your turnover ratio? I figured she was going to say like 60, 70%. She said 125%. I like to fell out of my shoes.
Oh, wow.
And so I said, what's the primary cause of that? She said, we don't have a good health insurance policy. Mm-hmm. Now, in that particular case, the brother-in-law was the broker. That didn't go over really well. But having said that, we were able then to go back and put something together, and their retention rate and their turnover rate dropped dramatically because they had a Blue Cross plan now. Mm-hmm. Okay. Yeah. And so, but that took us, I don't know, at least 90 days to pull that together, and we had to figure out why were they having this problem?
With a broker, you don't want to go with the saying, if it's not broke, don't fix it. You really want to take the opportunity to shop. The things that you need to assess your broker on is, are they providing you with the service you need day to day? Are they meeting your needs?
Like you just described on the insulin pump or on the prescription
That's
drug
right.
coverage show.
Are you getting the partnership and value from your broker? Are they keeping up with compliance and technology? If any of those you have concerns about, it's a sign that you need to shop for a new broker. And it doesn't cost anything to shop for a new broker. You make the phone call, we gather some information, we try to understand what your organization composes of, what your goals are, what your pain points are, and then we put together a package, a strategy that says, here, this is what we recommend. And we work together as a team with our clients.
And that makes it work really well. Let's take just one little side note here as an example of people. I usually found that employers are extremely ignorant, not well versed in COBRA benefits.
That's right.
And so just give if you can, a snapshot. Sure. Cheryl, you can do this. Of if they don't know what they're supposed to do for COBRA, what can happen if they miss the COBRA deadlines and don't do the things they're supposed to do to inform that employee that they have a right to COBRA. Before we go to break, just do that.
Well, there's just the ramifications of, one, there's fines involved. The government will fine you if you have not given that employee their election form or their chance to elect COBRA. Then obviously you've got an employee that didn't know that he was able to continue those benefits, and if that employee has a major health issue and he can't continue to get coverage until maybe his coverage with his new employer starts, in my mind, that's a lawsuit just waiting to happen.
Yeah, and here's the other one. The employer that does give the employee that information, but doesn't have proof that they got it in a timely manner, now the employee falls off a bicycle, goes to an ER, doesn't have coverage. The ER bill comes in, it's this is a true story, by the way. Yeah. It's $15,000, and they're telling the employee, you never gave me my benefits. You never, and so the way it works with the Department of Labor is you're guilty until proven innocent. So unless you can prove, and we had a company that did that. The company was called Cobra Guard, and they documented everything, and we never had a problem because we had proof positive that they received the information and we could refute any claim that they have. But if you don't do that, like you said, the employer is liable. And that's the issue. And I think, unfortunately, a lot of times you're busy. You've got a business to run. I get it, okay? But that's why you need these people because, as I said, you don't know what you don't know. If you want information, you want help from the folks at RPS Benefits by Design, 877-385-2224, 877-385-2224. She's going to Phoenix. She can go anywhere you want her to go. Pick up the phone and give her a call. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You know, if you want to learn more about what these folks do, I've got Maria Allers in studio today. She's the Chief Operating Officer, and Cheryl Lawrence, who is the team leader there. You can tell by listening to these two ladies, they understand the business. They understand what they're doing. I'm doing this show to educate. Yes, we would love to see you pick up the phone and give these folks a call, but you're learning something here today. You're learning what you shouldn't do, okay? And you're also learning what you should do, all right? And how that can affect you and drop your level of frustration. Employee benefits are a real pain in the neck, okay? Especially if they're not administered correctly, especially if the broker says, why don't you call the 1-800 number at the insurance carrier? The one that I call the 1-800 I don't give a damn number. You're never going to hear that here, okay? Because they do, what they do is exactly the way it should be done. They're there to help you in your time of need. And that's really what it's all about, okay? The phone number to reach out to them is 877-385-2224, 877-385-2224. How important is transparency when you're dealing with a broker?
It's the golden rule. I mean, you've got to, we believe in being very open with our clients. There are some faux pas in the industry that says, don't talk about rates, don't talk about the fees you charge. The fact of the matter is everyone knows we get paid. We have to get paid to be able to stay in business. We're a business, right? I mean, that's how we have to have revenue. So there's a new law that came out a couple years ago that we call the compliance. What is it? The CAA is what it stands for. And what it does is brokers are required by law to provide clients with a notice annually of how much commission or fees they're getting from the client. And so we have to provide that to our clients on an annual basis to let them know how much our commissions are. Not every broker likes to talk about it, and that's why the law came out, is because of the transparency law. It's important for our clients to know exactly what they're paying us.
And I'll bet you, a lot of you listening to this, watching this on YouTube or listening on podcast or listening on the air, didn't know that existed. And I'll also bet you that you've got brokers out there that probably haven't told you what they're getting paid. You know, it's important to understand there's a value to what brokers do, assuming they're doing their job. Okay, and it's also important to know, for you to know what they're getting paid. And you know that's important for a couple of reasons. You know, if a broker's pushing somebody toward a specific carrier,
that's right,
and there's a difference in commissions,
that's
okay,
right,
then that employer needs to understand or be able to ask, well, is it always the same regardless of what carrier we use, or are you getting more here? Maybe you're getting what's called an override, or maybe you're getting a bigger commission. Talk about that a little bit, because there is a difference there, and you need to understand that.
Yeah, and I think the best way I can explain it is through an example. We had a client, a large, over 100 employees. This client had been with the same broker for 20 years, and they stayed with the same carrier for 20 years. And their biggest pain point.
You're serious?
Yep, their biggest.
For 20 years with the same carrier.
Yep. And the reason why, well, let me go back. The owner's, the CEO's pain point was the cost of medical premium was so high that his participation wasn't up to the level that he needed it to be.
Meaning the employees wouldn't do it because they
couldn't afford it.
Right.
And so he reached out to me, and we went out to market and got quotes from all the carriers and mirrored their plan and found them a less expensive options to offer their employees. But that broker that he worked with was a good friend that he had known from childhood. And that broker specifically wanted to work with the carrier that they stayed with because they had a good relationship and because he knew the fee payment.
Yeah, and so and this happens all the time.
Mm-hmm.
I mean, I remember working with an electrical contractor, one of the biggest ones in the city, and the guy that was his broker was his college buddy. They roomed together, and he played golf with him and all the rest of it. And I went and looked at the policies, and I went, "Oh my God, you're getting killed. This is terrible." And we came back and showed him a better way to do this at a lower cost. And of course, then the other broker came in, and they came in with a number that was reasonably close. And when I went back to the employer, I said, well, I wonder why he didn't tell you about that 5 years ago or 4 years ago or even 2 years ago. So the point is, that kind of thing goes on all the time. And it has to be more. There's nothing wrong with having a friend in this business, but by the same token, if you're an employer, you better think about that a little bit and think about maybe it's time just to talk to somebody else and see, is this really going the right way?
That's right. And I always say, call us. We are happy to let you know if what you have works, is the right option for you. If that works, that's great. If not, we will give you our suggestions on what we think might be a better strategy. The other piece too, and we talk about finding a broker, is complex because you've got to have the experience. This client that I'm talking about, they were on ACA with 100 plus employees.
Oh
Now, for those that don't know what we're talking about, that's probably the most expensive plan you could offer.
That's an Affordable Care Act, Obamacare group policy. And let me guess, you moved him to a large group policy.
Yeah, that's right, which then caused him to get a surplus at the end of the year that he could utilize to put back into his benefits package.
So that's exactly what I'm talking about. It's a classic example of what goes on and what people don't understand that's going on out there in the workplace. And oftentimes, like I said, obviously we would love to have you pick up the phone and call these people. But the purpose of this show, and we're going to run this across the country as they always do, is to educate you as an employer, an HR director, a partner, whatever the case may be, into what you should be looking at when you're looking at business. Because as Maria said in the opening of this show, this is 25 to 40% of payroll. Think about that. Mm-hmm. And guess what, folks? I haven't seen a premium go down.
No.
They're not going down, okay? And what's happening in the marketplace is employers are having to cover more and more and more of these things because the government's making them do it. So it's important to get the right kind of help and professional help. If you want help, 877-385-2224, 877-385-2224. Thank you both for being in here.
Thank you,
It
Carrie.
was a great show today. And now I leave you with this thought from Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone will find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.